Hello, everybody. We are going to go over the ASERVIC competencies today. Um, this is something that, upon getting interested in this topic and this course, I was unaware was even a thing. So I was grateful for the awareness of this, learning it, and kind of getting more information on it. So we're going to go through these to make sure that you all are also aware of these, since these are the basis of what we will be doing in this course. The ASERVIC standards, crafted by the Association for Spiritual, Ethical, and Religious Values in Counseling, serve as guidelines to foster ethical and impactful counseling practices that integrate spiritual, ethical, and religious dimensions within therapy. Over 2 decades ago, the counseling profession received a significant call to action regarding competent multicultural counseling with diverse populations. So, because of this, this led to comprehensive multicultural competency standards beginning the conversations, right? So these standards focused on three different dimensions of competence. So you had beliefs and attitudes or self-awareness, and then you also had knowledge and skills. In 2009, the Association for Spiritual, Ethical, and Religious Values in Counseling underscored the importance of counselor competence in addressing spirituality. They developed specific, validated competencies for this purpose. So that's kind of what we see today, and what is going to be in here. So this is the preamble of the competencies. So these competencies aim to acknowledge and respect the diversity of clients' spiritual, ethical, and religious beliefs while embracing a cross-cultural approach that values their worth, dignity, potential, and uniqueness within their social and cultural context. So what this is pretty much saying is they seek to ensure that counselors are well equipped to engage effectively with clients from different backgrounds, including those with diverse spiritual and religious perspectives. So I think a lot of times when we think about multicultural, we don't really put into play the importance of spirituality differences. And so I think that this is really important to note, and I'm really glad that you all are taking this course to learn more about that. One of the things that I want to make very clear, and this is stated in the preamble, is that the competencies for addressing spiritual and religious issues in counseling serve as guidelines that work in conjunction with the principles outlined in ACA Code of Ethics. So they are crafted to complement the values and standards of the American Counseling Association by specifically addressing the integration of spiritual and religious dimensions into counseling practices. So these are not to replace, this is not to be something different. This is supposed to work in line with the ACA Code of Ethics. It's also important to emphasize that these competencies do not replace evidence based counseling approaches or established best practices. They are designed to be utilized alongside such approaches, enhancing counselors' capacity to deliver ethical and impactful counseling services that align with the client's beliefs and aspirations. So, we're going to go through a few different evidence based approaches and theories that you can utilize from a spirituality standpoint. So understand, right, again, these competencies are just a guideline that work alongside things that you are already trained and supposed to adhere to as a licensed professional. Some components of ASERVIC is cultural and worldview, counselor self-awareness, human and spiritual development, communication, assessment, diagnosis, and treatment. So what you will find is the competencies are broken into these different components, all kind of focusing on that. And you will also notice that within this course, we have broken up the modules based off of these components as well. So culture and worldview, you have these two competencies. So the first competency is the professional counselor can describe the similarities and differences between spirituality and religion, including the basic beliefs of various spiritual systems, major world religions, agnosticism, and atheism. So this standard really emphasizes the importance of counselors understanding the differences between spirituality and religion, as well as the diversity within each category. So understanding that spirituality refers to an individual's personal connection to something greater than themselves. Often this will involve a sense of meaning, purpose, and transcendence. Religion, on the other hand, typically refers to organized systems of beliefs, practices, and rituals shared by our community. So, making sure that we do understand the difference of those and kind of what they are. Counselors should also be knowledgeable about the basic tenets of different spiritual systems. So, understanding, I had talked about this in the tree ring activity, but it's important for us to understand that there are a lot of different aspects to this, a lot of different perspectives. And we as counselors should always be open to learning more about those things because you'll never know it all, unfortunately. But you should make it a point to learn more about them, especially if you are treating clients that have different spiritual perspectives than you. The second one under culture and worldview is the professional counselor recognizes that the client's beliefs or absence of beliefs about spirituality and or religion are central to his or her worldview and can influence psychosocial functioning. Um, so this really is just trying to point out that there can be a significant impact on the client's overall worldview and functioning based on what they believe in or don't believe in. So, for many individuals, spirituality and religion serve as foundational aspects of their identity, which can guide them for their values, decisions, coping mechanisms, and sense of purpose. So, understanding that, you know, what a client believes in or doesn't believe in and how they practice that and integrate that can be really important for the understanding and treatment of a client. So, we as counselors need to acknowledge and respect the central role that these play in clients' lives. We need to understand the influence of spirituality or religion on the functioning. And then we also need to be able to effectively assess and address how these beliefs may contribute to client strengths, challenges, and overall well being. Okay. The second component is counselor self awareness. Within this, we have three. So, the first one is the professional counselor actively explores his or her own attitudes, beliefs, and values about spirituality and religion. So, understanding that you as a counselor should also be engaging in self reflection and introspection regarding your own attitudes, beliefs, and values related to your own spirituality and or religion. You should be aware of how your own worldview may influence your perceptions, interactions, and interventions with a client who may hold different spiritual religious beliefs. Lucky for you, you're going to be doing a lot of that in the tree ring activity. So as long as you continue to do that, then you are adhering to this one. The next one is the professional counselor continuously evaluates the influence of his or her own spiritual and or religious beliefs and values on the client and the counseling process. So kind of building on the previous one, it's important for you to not only become aware, but it's also just as important for you to continue to evaluate and monitor how your own spiritual or religious beliefs may influence the counseling relationship and process. So you must continue, examining any potential biases that may come up, countertransference issues, or value conflicts that could arise during therapy. The last one on here is the professional counselor can identify the limits of his or her understanding of the client's spiritual and or religious perspective and is acquainted with religious and spiritual resources including leaders who can be avenues for consultation and to whom the counselor can refer. So what this is saying is that the counselor recognizes the boundaries of their own knowledge and understanding when it comes to clients' spiritual or religious perspectives. So, understanding that you should humble yourself enough to know that there are areas where there may be lack of expertise or cultural competence, and you may just not fully understand all of the areas. Like I said, you will never know it all. And so, it's important that you should be familiar with religious and spiritual resources that include community leaders, clergy members, experts in specific traditions, or people who can provide consultation or serve as referral options for clients seeking more specialized support in areas that you may not be competent in. So remember, you should only be practicing well within your competencies, anyways. So, like I said earlier, this is falling right in line with things that you are already adhering to. This is just an added principle to kind of give that spirituality perspective. All right. In the human and spiritual development component, we have one competency, which is the professional counselor can describe and apply various models of spiritual and or religious development and their relationship to human development. So just some things to kind of consider. You have James Fowler's stages of faith development. Fowler's model proposes 6 stages of faith development from infancy to mature faith. It emphasizes the cognitive and social aspects of faith, including how individuals perceive and relate to the divine or spiritual realm. So that could be one. There's a lot that can go into this, so I'm just going to give you a few of them. One that you may have already be well aware of is Maslow's hierarchy of needs. So while this isn't directly related to spirituality and religion, self actualization within Maslow's hierarchy of needs can encompass spiritual growth and fulfillment. You also have Eric Erickson's psychosocial development. Um, Erickson's stages of psychosocial development span across the lifespan, highlighting key conflicts and tasks at each stage. The final stage, integrity versus despair, often involves a search for meaning and spirituality. Um, and then, of course, like I said, there are other ones. We're going to go through a few different ones of these, but if you want more resources, we can always provide that as well. The next component is communication. So under this one, we have 3 competencies. The first one is the professional counselor responds to client communications about spirituality and or religion with acceptance and sensitivity. So understanding that it is important for you as a counselor to respond to the client's communications about their own spirituality or religion in a manner that is accepting, non-judgmental, and sensitive to the client's beliefs and experiences. So making sure that you're creating a safe and non-threatening environment where they do feel accepted and respected. Also demonstrating sensitivity by actively listening to their expressions of spirituality and religion and acknowledging the significance of these aspects in their lives. You should also work to validate their experiences without invalidating or dismissing them. And then also making sure that you are culturally competent enough and aware enough to be sensitive to the diversity of the spiritual and religious beliefs across different cultural and social contexts. Okay. The next one is the professional counselor uses spiritual and or religious concepts that are consistent with the client's spiritual and or religious perspectives and that are acceptable to the client. So this standard really emphasizes the importance of aligning counseling interventions and discussions about spirituality and or religion with the client's own beliefs, values, and perspectives. So it's really important to make sure that you are taking a client-centered approach. And really making sure that you're using the client's own words, language, level of comfort, and worldview when addressing these types of things. You should also make sure that you have respect to the diversity of spiritual and religious beliefs, and that you are also having collaborative discussions with the client to make sure that they are kind of the expert of their own spiritual and religious understanding. The next one is the professional counselor can recognize spiritual and or religious themes in client communication and is able to address these with the client when they are therapeutically relevant. Um, so you want to make sure as a counselor, you have the ability to identify and address spiritual and religious themes that emerge in the client communication in a therapeutically relevant way, right? So you want to make sure um, that you're aware to certain spiritual and religious themes that may come up in clients' narratives, maybe their interactions or how they present themselves. You want to make sure that when these themes do become relevant, that you are integrating them into the therapeutic process and goals of their treatment. And then you also want to make sure that you are approaching these discussions with openness, curiosity, and respect, and really allowing the client to kind of explore and make meaning of their own experience and not placing that meaning there for them. The next component is assessment. So in the assessment, we have one competency. During the intake and assessment process, the professional counselor strives to understand a client's spiritual and or religious perspective by gathering information from the client and or other resources. So this competency really focuses on the intake and assessment process, which emphasizes the importance of counselors striving to understand a client's spiritual and or religious perspective by gathering information directly from the client or other close resources. So you want to make sure that when they are presenting information, you are really understanding their personal history, strengths, challenges, and other relevant factors that may come up. One thing that I think could be really important in the assessment process, that you're actually going to be doing, a lot of the things that you're going to reflect on for yourself in the tree ring activity is going to be just as important in the intake and assessment process when working with another client. Um, so you want to make sure that you're taking what the client is saying, assessing appropriately, and again, using their own language to understand their perspective and then integrating that into the treatment process. All right. And then the last component is diagnosis and treatment. So under this, we have four competencies. The first one is when making a diagnosis, the professional counselor recognizes that the client's spiritual and or religious perspectives can enhance well-being, contribute to client problems, and or exacerbate symptoms. So what we mean by this is just making sure that you are considering the client's spiritual and or religious perspectives during the diagnostic process. So you should recognize that these perspectives can have varying impact on clients' well-being, which can contribute positively or negatively to their mental health. So you want to make sure you're kind of taking that holistic approach of the client. Um, Also, understanding that some clients' spiritual or religious beliefs may serve as sources of strength, resilience, coping, and support. So, that also can contribute positively to the therapeutic outcomes. On the other hand, spiritual or religious beliefs may also contribute to clients' problems or exacerbate symptoms. So, if there are conflicts, guilt, shame, or distress related to their beliefs, understanding that this can have a more negative impact than what I had stated before. And then lastly, again, right, just making sure that using the client centered approach, that you consider the multidimensional factors influencing clients' mental health, which does include a spiritual and religious dimension. The next competency is the professional counselor sets goals with the client that are consistent with the client's spiritual and or religious perspectives. So this is where that collaboration is really going to come in handy. So you want to make sure that you are collaborating in order to set goals between the counselor and the client. And really ensuring that the therapeutic goals align with their spiritual and or religious perspectives, values, and beliefs. You also really want to make sure that you're respecting their autonomy. Setting goals that are consistent with the client's spiritual religious perspectives demonstrates respect for their autonomy and can promote a sense of ownership and investment in their own therapeutic process. And then you also want to make sure that you are integrating their values. So a lot of times you can enhance like the relevance, meaning, and effectiveness of therapeutic interventions if you are working from the client's own values and perception. All right, the next one on here is the professional counselor is able to modify therapeutic techniques to include a client's spiritual and or religious perspective and utilize spiritual and or religious practices as techniques when appropriate and acceptable to a client's viewpoint. So this standard really emphasizes the counselor's ability to um, adapt therapeutic techniques to incorporate clients' spiritual or religious perspectives. This may involve modifying interventions um, using different language, metaphors, or activities that may resonate with the client's worldview. When appropriate and acceptable to the client, counselors can also integrate spiritual or religious practices into therapy as therapeutic techniques. Some of this may include mindfulness, meditation, prayer, ritual, or other practices that align with the client's beliefs and goals. So, if you're going to be integrating spiritual practices, it's important to let the client tell you how they practice their spirituality. Don't make an assumption about how they practice just based off what they tell you. And don't just think that they agree with the same practices that maybe you are aware of, that people agree with, or maybe that you agree with. So make sure they're telling you how they practice their own spirituality. And then the last one on here is the professional counselor can therapeutically apply theory and current research supporting the inclusion of a client's spiritual and or religious perspectives and practices. Um, so this standard really shows the importance of using those evidence-based theories and current research to support the therapeutic inclusion of clients' spiritual and or religious perspectives and practice. It's also important that you are staying informed about relevant theories, research findings, and best practices related to integrating spirituality and religion into counseling. So you, as a counselor, are, excuse me, you as a counselor are always going to be learning. Um, and so, with that, means that if you are going to be focusing on including spirituality practices within your counseling approach, just making sure that you're staying informed about what the current best practices are. And then also considering any ethical guidelines, cultural sensitivity, and client preferences when incorporating spiritual or religious perspectives into therapy. So just ensure that your interventions are appropriate and beneficial to the client. Okay, so what does this mean for counselors, right? So, like, what does the ASERVIC competencies really mean for you all? The ASERVIC competencies are essential for counselors because they promote inclusivity, cultural competence, ethical practice, holistic well-being, um, collaborative relationships, and ongoing professional development, and addressing spiritual, ethical, and religious aspects of counseling. So, integrating these competencies into your practice, you can really provide comprehensive and effective support to clients across different backgrounds and belief systems. Um, and it's just as important, like, to really help understand, like, this gives you that guideline to understand what your role is as the counselor, especially when addressing spirituality and or religion in your counseling session. So, I hope that this was informative. Of course, if you have any further questions, please reach out to myself or Dr. Smith. We'd be happy to go over it more. But I think by understanding these, it'll give you a really good framework and foundation for the things that we are going to be going over in this course. So, I hope you all have a great day, morning, evening, night, whichever time you're watching this. And like I said, I look forward to kind of seeing what you all gain from this course.